Hi again, this is Mark. This is your 5-minute break. This is basically a follow-up to the previous broadcast where I introduced myself, gave a little bit about myself, a little bit about my background, what I do, etc. What I thought I would do, because I think this is so important, I wanted to make this like a 5-minute break for the first responders, for the people working the healthcare system, for those taking care of others at this particular time, at this most difficult of times. Personally, it's the most difficult time I have ever experienced in my life. To the patients that I see, it is the most difficult time in their life. To what I hear and what I read and what I see of people interviewed who are on the front lines, it is most definitely the most difficult time in their lives too. I would say it's probably akin to those workers that were around treating 9/11. So I want you to take a break. That's what this is for. I want you to be able to take a 5-minute break. Because as inundated as the workers are, they all need to take a break, both mentally and physically, even if it's just 5 minutes. I was thinking about things to do to cope, even if it's just 5 minutes. Try to find a safe space. If you go to the bathroom and sit on the toilet for a while, if you walk outside, for those of you that smoke, go have a smoke break. Not that that's the most healthiest thing in the world, but still, just get away from it. Look up a book that you read on your phone. I'll tell you some of the things that I do, and I'm not trying to trivialize anything, because when I think of what I do and the patients that I see now compared to what first responders are going through, I feel inadequate. But a lot of times I hear a lot of heavy things, especially with dealing with PTSD patients. And seeing 6,000 to 7,000 patients a year, I often have patients ask me, how do you get through this? How do you survive? How do you make it? How do you see 18 or 20 or 25 of us a day and come out of it being sane? And a lot of times I say to them, I always have a safe space. My safe space is, and sometimes I'll do this for a minute or 2 or 3 minutes between patients. I'll grab my phone and I'll read a few pages of the book that I'm reading. Or I'll watch a few minutes of the TV series that I'm watching. I like to do that. I like to go into Netflix or Prime Video, and I always have a series or a movie, but it's mainly series of what I'm watching. For example, say, and I did this when I watched Breaking Bad, between patients, I would grab my phone and I would just continue, and I'd watch 2 or 3 minutes, and it would take my mind away from it. Another thing I like to do is I like to read about swimming. So I'd read swimming results, or I'd look up world rankings, or I'd look up world record progression times, or something like that that's very much interests me, that takes my mind away. That's what I would absolutely encourage you all to do. You need to find, and everybody has something, and it's what I tell patients. I tell patients this a lot. I tell them, try to find something every day that you enjoy. And it doesn't have to be like, hey, I'm going to Disneyland. Disneyland's closed. But it has to be something, and maybe reading Garfield in the daily newspapers. It may be watching your favorite show when you get home. Who knows, maybe tuning into the weather when you get home off your shift, because that's what you enjoy doing, and that signifies the end of your shift. There are many healthy things we can do. Even if it means going downstairs to the cafeteria and having a milkshake, do it. It's okay to get away from it and not think about it. One of the things that my wife and I do in our practice is that we like to pick the patient of the day. We've done this for years, and at the end of the day, she will always ask me, who is your patient of the day? And this may be a patient that said something. This may be the patient that had some kind of revelation. This may be somebody that just managed to come through something, and that's the reward. I want to try to motivate you all, because you're probably asking yourself, why am I going to work? What's the reason? What's going to keep me motivated? It's to get the reward of helping these people. Another thing that I would suggest is try to limit the news that you're watching. I tell this to my patients, because especially the patients that suffer from general anxiety disorder and panic disorder, this is extremely difficult times for them. You're talking about people that are struggling to get out of the house just to go to the grocery store at the most normal of times. In these days, it is absolutely terrifying for them, especially those that suffer from severe agoraphobia. So try to do it. Try to be there. Try to get through things. I tell patients as well, try not to watch the news as much as you are, because the news is inundating us with so many facts and figures that it could become a little bit overwhelming for people. Another thing people can do too is, if you have a particular person, talk to them about people. Talk to a person, talk to a coworker about your patient of the day. Discuss with people, especially if you've lost people. I'll never forget, about 15 years ago, my wife was working on an oncology unit, and she called me at about 9 o'clock. She'd gone on at 7 o'clock, and by 9 o'clock she'd already had 2 patients pass away, and she was dealing not only with the aftermath, and they were both patients that she'd been treating for a few months, so she got to know them very well. She got to know their families very well, and it was devastating on her. And I remember her calling me, and we spoke, and I remember telling her to go out, take a breath, go out and just take a break for a few minutes, get some fresh air. And she did do that. When I think of what the first responders are going through now, they may be in a situation where hundreds of people are dying in the same day, or they're losing 20 or 30 people per shift. It's horrific. And that's so important, to take a break, to take those 5 minutes, to try to find things that you enjoy to do to cope. And when you get off your shift, try to find something, whether it's taking a long bath, watching your show, listening to music. Music is huge. Music is one of the greatest outlets of stress. I will talk about this more on some of my broadcasts, but I use music a lot in terms of the therapeutic value of music. For those of you that have kids, try not to discuss too many things with your kids, especially about losing patients, especially about new figures that come out. My wife and I have gotten to not discussing these things with our children because they are rather young and it's difficult for them. Please, I plead with you to send me comments. I will address the comments, and also tell me about your patient of the day. I would be interested to hear that. We're all human, we're all in this together, and we all feel for each other, especially during times like these, and I have a feeling that that's maybe why this is all happening. So to end off, I will do the following. My little boy brought me these things. Tell me if it's all good, and that's in his writing. He's just 7 years old. Please subscribe, or subscribe, as he put it so beautifully. And also, if you like it, give me one of these that he did, a thumbs up. Thank you.
And click on the notification bell.
Click on the notification bell too. Thank you. Thumbs up to you all. You are all in our thoughts and prayers, and we honor and respect everything that you are doing. God bless.